Do you want to have bowel movements that are so timely and precise you can literally set your clock to their arrival? I'm Dr. Robynne Chutkan, gastroenterologist, microbiome expert, and author, and I am here to help you find gut bliss. On today's show, true story about an encounter in the emergency room almost 20 years ago. It's 1996, and I'm a GI fellow at Mount Sinai Hospital in New York when I get a message on my pager. Yes, my pager. We were still using those back then. The message says, fecal impaction in emergency room needs GI evaluation. If you're wondering what a fecal impaction is, and if it's as bad as it sounds, I'm going to explain what it is. But I want to tell you that yes, it is as bad as it sounds, both for the person who's impacted and for the person doing the disimpaction, who at that moment, since I was holding the pager, was going to be me. A fecal impaction occurs when somebody gets so constipated that the stool in their rectum hardens and it literally turns into concrete. We actually describe it as fecal concretions. And the GI evaluation they were requesting in the ER was really just a nice way of saying, get down here and dig all of this hard stool out of this person's bottom. It's sort of a rite of passage when your team is called down to the ER for a fecal impaction, usually in a constipated elderly patient from a nursing home. And when you are the lowest ranking person on the team, you end up being the disimpactor. So of course, that day back in 1996, I immediately start looking around for the lowest ranking person on the team, the medical student or intern. But alas, both the intern and medical student on our team that day were up in the endoscopy suite and they were busy watching procedures. And I really just didn't have the heart to pull them away to do a fecal disimpaction. So the next thing I start looking around for is a constipated elderly patient from a nursing home. But when I get to the stretcher of the patient I'm supposed to be evaluating, i.e. disimpacting, I see what appears to be a 30-something-year-old man, and he is built. He is no nursing home resident. He introduces himself as Adam, and Adam could literally pose for an anatomy textbook. Every muscle in his body is honed and defined, and for sure he has single-digit body fat. He has an Ironman tattoo on his arm that I immediately recognize because I am obsessed with the Ironman. Anybody else obsessed with doing an Ironman? Glutton for 140.6 miles of punishment? Okay, we're going to fast forward now from 1996 to 2012, when I signed up to be a medical volunteer at the Ironman Championship in Kona, Hawaii. Competing at Kona is on my bucket list, but I am not quite there. Okay, I'm not even close. I've only done a bunch of marathons. So volunteering was really my best shot for getting to Kona. And I was really curious to see what it would be like to swim 2.4 miles, bike 112 miles, and then run 26.2 miles in 100-degree heat. The year I volunteered in 2012, Pete Jacobs of Australia won the men's division and Leanda Cave of England won the women's. And just to put it in perspective for you in terms of what kind of effort is involved, Pete Jacobs' overall time for winning the Ironman that year was around 8 hours and 18 minutes. And his marathon finish time was 2 hours and 48 minutes, which means that after swimming 2.4 miles in the ocean and biking 112 miles, he then ran a full marathon, 26.2 miles, at about a 6.5-minute mile pace in 100-degree heat. I was there working in the medical tent when those first elite athletes came in off the running course, people like Pete Jacobs and Leanda Cave. And let me tell you, these are people at the peak of physical performance. They do not even look like the rest of us. Coming up, I am going to tell you about Ironman bowel movements, what they are, and how to get them. The Gut Bliss podcast is brought to you by Visbiome, my first and quite frankly, my only choice for a probiotic. Whether you're dealing with irritable bowel syndrome or just looking to restore your gut health, Visbiome can help. It's a medical food for the dietary management of IBS and gut inflammation. Backed by science and clinically vetted by thousands of my own patients, find your gut bliss with VizBiome. Go to vizbiome.com/gutbliss and use discount code GUTBLISS at checkout. My observation, inspired by that Ironman championship in Kona, is that there are three kinds of people. Uber athletes like Ironman competitors, couch potatoes, and then everybody in between, which is most of us. But with bowel habits, there are also three categories. Ironman bowel actions that are so timely and precise, you can literally set your clock to their arrival. Couch potato bowel actions that are always late and sometimes stand you up altogether and they don't even arrive. And then in-between bowel actions that are generally pretty good, but they could be better. Which kind of bowel habits you have, Ironman, couch potato, or something in between, is also related to your physical activity. Although fortunately, it does not take swimming, cycling, and running for 140.6 miles to have timely bowel movements. And of course, there are some additional factors beyond exercise that affect bowel activity. But here is what I want you to remember. Your digestive tract is one long muscle. And if you're not moving enough, there is a good chance your bowels won't be either. We know that runners actually have superior bowel movements, not as hard, bigger, and more frequent. So let's talk a little bit about that inner workout that's going on inside you. Your intestines are made up of muscles that propel and mix the digested food as it travels through your GI tract. And this muscular movement is, of course, called peristalsis. It's those sort of loud noises that your GI tract makes. And peristalsis consists of wave-like motions as your muscles contract and relax. And those muscles are arranged in layers. You have circular muscles alternating with longitudinal ones. Contraction of the circular muscles initiates peristalsis, and then the longitudinal muscles provide the propulsion. So you have this initial contraction and then forward motion. And it's actually the exact same mechanism that earthworms use to move around. Unlike our biceps or hamstrings, which are skeletal muscles and under voluntary control, we can decide when we want to move them, our intestinal muscles are smooth muscles, and they are under involuntary control. But despite the fact that peristalsis occurs without our effort or really even our consciousness, our level of physical activity has a huge impact on those muscular contractions. And in fact, exercise is one of the most important stimulators of peristalsis. And there are three mechanisms for how that works. Number one, exercise speeds up the transit time through your GI tract so that your stools arrive at their final destination faster. Number two, gravitational forces that are at work during exercise help to move your stool downward towards your rectum, towards the finish line. And number three, exercise increases production of nitric oxide, which is a chemical that relaxes the smooth muscles of your digestive tract and helps to speed up peristalsis. So faster transit time, gravity to help move things in the right direction, and nitric oxide to activate the intestinal muscles. These are all key ingredients if you are trying to have Ironman bowel movements. Okay, speaking of Ironman, let's go back to 1996 to the emergency room and the GI evaluation. Given what I've just told you, how is it possible that this Ironman Adonis, Adam, the patient who is waiting for my GI evaluation, i.e. disimpaction, how is it possible that he has a fecal impaction? He should be having Swiss watch precision bowel movements. I lift up the sheet covering Adam on the stretcher, and I ask him to turn on his left side to begin my disimpaction when I notice a really important clue. He is wearing a soft boot on his leg. He tells me he twisted his ankle running trails and he tore 3 ligaments, and he's been sidelined now for about 6 weeks. He can't run, he can't bike, can't swim, he can barely walk around. Exercise was Adam's foolproof way to keep things moving, literally. It was his way of treating constipation. Now, why was he constipated? Adam also had a history of serious depression, and he had been prescribed a type of antidepressant called an SSRI, which stands for Selective Serotonin Reuptake Inhibitor. SSRIs can be very constipating, and the medication Adam was on had really slowed down his bowel movements. But once he took up triathlons and he started working out regularly, the exercise had helped his mood so much that he was able to completely stop the SSRI, with the help of his doctor, of course. And once he was off the SSRI, his bowel movements improved dramatically and he was no longer constipated. But since getting injured, he wasn't able to exercise and his depression had gradually returned and he ended up back on the SSRI and super constipated once again. Plus, Adam told me he usually drank about 3 liters of water when he was training. So here was this perfect storm of no exercise, a very constipating medication, and much less hydration. And I'm going to circle back to the hydration part in a minute. Okay, this all sounds great, but what about the downside? From a GI point of view, are there any hazards associated with exercise that I should be telling you about? Intense exercise for long periods of time, think Ironman training, has been known to cause symptoms like nausea, diarrhea, and rarely gastrointestinal bleeding because so much blood is being shunted to large muscles like your hamstrings or quadriceps and not enough to your intestines. But these symptoms are almost always with very extreme exercise. And we can even consider them protective because, if you start having gastrointestinal bleeding or diarrhea or nausea, you are probably going to have to slow down or stop. And maybe that is your body telling you that you're overdoing it a little bit. If you ask me what kind of exercise you should be doing, I'll tell you that just like there are no bad vegetables, there really are no bad forms of exercise. Some are more dangerous. I like to horseback ride and snowboard, and I have had my share of injuries from those. Some require more skill or fancy equipment, but I really can't think of any that I would recommend you avoid altogether, assuming that you're hydrating, you're fueling properly, you're listening to your body, you're warming up, all the things. I'm a yogi and a runner, a slow distance runner, so I'm going to focus a little bit more on how those forms of exercise can be helpful with getting your bowels moving. For anyone who has ever done a downward facing dog, the GI benefits of yoga are not hard to believe. And yoga is sort of a twofer. It can relieve stress, and it can also relieve the actual physical symptoms of many digestive disorders. And that's in part because yoga strengthens your core abdominal muscles, and that helps to bind your intestines in place and prevent bulging and bloating. The breathing techniques in some forms of yoga, that sort of belly breathing, can provide pain relief, and twisting poses can help improve gas and constipation. Gas in your GI tract tends to get trapped in 2 places, the left upper corner of your abdomen where the spleen can press on your bowels and the right upper corner where the liver can do the same thing. And so yoga poses that involve twisting at the waist can help to disperse those gas pockets and relieve pressure. And studies also show that yoga can raise levels of the feel-good hormone serotonin and decrease stress-related hormones like cortisol. So it can improve both mood and symptoms. If you read through the psychiatric literature, you will find a lot of articles about long-distance runners getting depressed when they stop running. But if you examine this phenomena carefully, what becomes clear is that for many of those athletes, it's not the absence of exercise that's causing their depression. It's the presence of exercise that's treating it. Many people have consciously or subconsciously figured out that running and other forms of exercise improves their mood and keeps their depression under control. I've seen the same phenomena in runners who develop constipation and bloating after an injury sidelines them. A daily run had been their foolproof guarantee of satisfaction in the bathroom and the end of bloating. So their stool nirvana is very much tied to their exercise routine, and that was definitely the case with Adam. Running burns about 100 calories every 10 minutes, assuming a 10-minute per mile pace. So for most of us, even a 10-minute per mile pace will cause us to sweat. And sweating is a great way to remove toxins via what I like to think of as your external GI tract, your skin. When we sweat, we tend to drink more water. And more water is one of the fundamental rules for stool nirvana. Why? Because it improves your gut motility, it improves your lymphatic flow, it improves your stool consistency, and it improves your bowel regularity. So if you're good about replacing all the fluids you've lost from your running or whatever form of exercise, plus some extra, that can translate to great things in the bathroom. It turns out exercise is also really good for your microbiome. A British study compared stool samples from professional rugby players to those of healthy men the same age who weren't avid exercisers. And they found that the athlete's stool, the rugby player's stool, had more bacteria, greater species diversity, and significantly higher levels of species that are associated with low rates of obesity. But you don't need to be a professional rugby player to benefit from the microbe-boosting effects of exercise. Just elevating your heart rate to 20% above baseline with, a brisk walk, 30 minutes, 3 to 5 times a week, that is enough to stimulate peristalsis and help to maintain a healthy microbiome. I want to leave you with 3 takeaways about exercise and your bowel habits. Number 1, if you are not moving, neither are your bowels. It doesn't matter whether you walk, run, ride, swim, hop around on one leg. Just get moving. If you want to have Ironman precise, regular bowel movements, you need to do everything you can to increase your gut motility, and that means lots of movement. Number 2, the medicine cabinet can be a major source of constipation. Prescription drugs, over-the-counter remedies, supplements can all contain ingredients that slow down gut motility. So if your bowel habits are a little bit on the sluggish side, don't forget to take a good look in the medicine cabinet and discuss all of those medications with your prescribing physician. And finally, exercise is good. Exercise plus hydration is better. But if you really want to experience stool nirvana, try exercise plus hydration plus a high-fiber diet. So that's it for this edition of the Gut Bliss podcast on how to have Ironman bowel movements. Go to gutbliss.com for my free 7-day microbiome reboot course. If you like what you're hearing, drop a review and hit that subscribe button. And remember, dirt, sweat, vegetables, the best prescription for a healthy gut. Coming up next week on the Gut Bliss podcast, millions of people are exposed to viruses like HIV, herpes virus, and HPV and never, ever develop symptoms. We can predict chronic infection from these viruses based on the composition of your microbiome. Of course, avoiding unprotected sex is still the best defense against an STD, but a close second is having your own internal army of virus-slaying bacteria.
The information presented in this show is not meant to be medical advice. Consult your doctor before making any decisions about your health. The patients discussed are real people, but names and identifying features have been changed to protect their privacy.